Hi and welcome back to Coffee Brains. I'm your neurologist, Dr. Serdan. I'm here to bring you your daily neurobrew. Today I want to talk to you about Elon Musk and Neuralink. Have you heard about this? Is this the first time you hear about it? Well, yes, Elon Musk, the guy that has been on everywhere, basically social media, Twitter and Facebook and Instagram, mostly because he just recently bought Twitter. He's now making some headlines. He explained yesterday or demonstrated what Neuralink is about. Neuralink is basically a brain stimulator, like this size, like 1 cent size stimulator that is inserted in the brain and has more than 1,000 electrodes that can stimulate the brain doing some sort of activity or reaction. How this can happen? Very easy. Your brain is basically an electrical machine. Everything that you see, hear, smell, taste is just electrodes. It's an stimulation inside your brain that is telling you what you're seeing, what you're hearing, what you're smelling. So he's saying, if everything is just electrical, then if I put an electrode and I stimulate, maybe I can make somebody see, like a blind person, or maybe a quadriplegic can actually walk. And this is very interesting. It may be something that he can achieve. And why I'm saying this? Because in a way it has happened before. There is a pacemaker in the heart that is already established. It was done back in the 80s or 70s or something like that. And now is very well done, and it's a pacemaker like this size and goes behind your skin and stimulates your heart and makes a heart rhythm, right? And it's just an electrical impulse that is creating a contraction of your heart. And there are other brain stimulators, so this idea is not new. There's a brain stimulator that can actually control the Parkinsonian tremor. So it's not like he's just discovering something completely new, but he's taking that into another level. He's saying, well, what if I stimulate areas that are damaged by some reason? Like, let's say that you had a stroke and you stimulate the left side frontal lobe, creating a right-sided movement on somebody that had just recently a stroke. Or what happens if I stimulate the spinal cord, creating a bypass on somebody that just had a car accident and has a cervical injury? Can I make those people walk again? And this is a very interesting question. I'm very happy that he's doing it. I think there's going to be a lot of variants and a lot of complications, but maybe in a few years he can start doing and making some goals. But obviously that's going to come with some risks and some complications and adverse reactions like seizures or infections or so. But it's something that we need to keep an eye on because it sounds like it's going to be very, very interesting. He also talked about making people seen by making a connection in between a camera, a cell phone, and the occipital lobe with the whole area of vision is. I think for that he's going to need a lot of visual electrodes and a lot of stimulation and learning about patterns. But can it be achieved? I think so. I think it is possible, but again, it's going to take a lot of years. Well, I hope you like your Coffee Brains Neuro Daily Dose, and I'll see you tomorrow. Stay safe. Bye.